Hey, welcome back to the channel. Today, we're going to fix that tight and maybe even painful hip flexor of yours. Now, hip flexor complaints are super common. I hear about them all the time from people. And what I observe is that when it comes to managing those issues, most people just don't have very many tools in the toolbox. We often see that people will traditionally stretch their hip flexors and they will foam roll their hip flexors, and those things can provide temporary relief, but as you probably already know at this point, they don't really help that much in terms of a long-term solution. So my goal with this video today is to take you through a little sample protocol that will give you an idea of how we would approach hip flexor issues through more of a brain-based lens. There's going to be 4 parts to this video. The first part is we're going to go local, meaning I'm going to teach you a drill for the target hip. We're then going to go peripheral, meaning I will teach you a neuromechanic drill, that's a nerve mobility drill for the target hip. Then we're going to get a little weird. We're going to go opposing, which means we're going to work on the opposite side of the body, in this case with your shoulder to potentially help your hip flexor issues. And then finally, we're going to go higher order, and I'm going to teach you a vision drill. Yes, a vision drill that could potentially help you with your hip flexor issues. So I promise you have never seen anything like this before. You've never done anything like this before. I think you're going to find it super interesting, and make sure that you watch the entire video and go through the steps, because at the end I will summarize some of the interesting neuroanatomy that we know that supports why this stuff might be able to help you with, in this case, your hip flexor complaints. Are you ready? Let's get into it. All right, before we get into the protocol, it is super important that you have a way to assess the function of your hip flexors, because what you're going to be doing is getting a baseline assessment to see how you're moving and how you're feeling. And then after each step of the protocol, you're going to immediately reassess using the same assessment to gauge in the moment how your brain and your body is responding to the stimulus that you're providing it. So we're going to keep it really simple. You're going to do an active straight leg raise. And so from a standing position, maybe holding onto something for balance, with the side that you have the most complaints with, you're going to just do an active straight leg raise. So my leg is straight and I'm lifting it up, moving from the hip. And I want you to think about 2 things. Number 1, how easy or difficult is that motion? So as you do it, just kind of gauge, understand, okay, that's how strong I felt, and that's how easy or hard it felt. And then number 2, how far did you go? Okay, so as you do that, kind of take mental notes on how far you are able to lift your leg. And that's going to be your assessment. You can do that laying down if you'd like to, but I prefer to be in a standing position because it makes the assessment a little bit more specific to human function, right? We spend a lot of time, on 2 legs. I'm most interested in how your nervous system is interpreting what we're doing in this position, but if for some reason you have to be on the ground to do it, that's cool. I think you'll still be able to get the feedback that you need as you move through the protocol. Now, understand this part. I call it a protocol, and realistically, there is no such thing as a protocol. To me, protocols kind of imply that you're going to go through these steps, and these drills are going to be the 4 perfect things for everybody, and they're going to help everybody. And really, that's not true. This is all about a person's brain needs, right? And you are different than me. You have a different brain than I do. We both have our own unique neurology, and our brain and our body may respond differently to each of the inputs that we provide it. I've created a protocol based on things that have been very high percentage for people over the years, and based on my understanding of neuroanatomy. What your job is to go through the protocol to discover, by using the assessment process, which of these drills are the highest payoff for you. In a perfect scenario, all 4 of them will be amazing, and you'll get a result from all of them, and you'll be able to do all 4 of these drills in the future to help you. Great, that's probably going to happen to a fair amount of people, But there will also be folks that maybe go through the protocol and only 1 or 2 of the drills are helpful for them. And they may even discover that one of them actually makes them worse. And that's okay. Discovering what drills are not good for you is actually just as valuable as discovering what is good for you. In that scenario, you just simply won't focus on the ones that are regressing you, and you will kind of zoom in and focus more on the ones that are helping you. So we're going to use this assessment process both before you start all the drills, get your assessment, see where you're at, and then immediately afterwards, meaning after each individual drill, you're going to reassess to see how your body is responding to the inputs that we're providing it. This first drill is a pretty simple one, but it's actually pretty difficult to perform. It's called a straight leg hip circle. It's a joint mobilization for the hip. So after you figured out what side you're going to be working on, for me, I'm going to be working on my right side. What you're going to do is stand next to something for balance. It actually really helps. And you're going to lock out the leg that's going to be active. So I straighten it out at the knee. And from here, you're going to flex at the hip. You want to make sure that your pelvis is level. And you're going to flex at the hip. And now you're performing a circle. Think about tracing a circle with your foot. And that motion is coming from your hip. Okay, now it is way harder than you think. And actually, if it feels easy, you're not doing it correctly. You're probably nowhere close to working at your end range of motion. And so what I would like you to do is make the active component of the drill quite challenging, meaning the top of that circle is going to be where it's the most challenging, because you have to really contract your muscles, in this case your hip flexors, to achieve the top of that circle. And if possible, if you're able to do that without pain, I want you to work really hard to try to get that top of the circle to work at your end range of motion. So once again, you're going to flex, and now I'm working really hard from the hip to create that smooth, well-controlled circular motion. Now, what you'll often see with people when they do this is that they kind of get weird with their pelvis, meaning their pelvic maps are merged with their femur maps or their hip maps, and they kind of do this elevating, right, of the pelvis, thinking that they're moving their hip well very independently, but in fact, their pelvis is hiking and the pelvic map is merged to the femur. What we're ultimately trying to do here is differentiate between what is the femur, meaning the big bone that inserts into the hip. We're trying to differentiate that from the pelvis. The pelvis we want to remain very level and stable. But the femur, okay, the leg, is going to be the part that's moving and creating the circle. Okay, and that's really challenging because you have to stay nice and stable through the midline and make sure that you are making the movement using good coordination. You can do this in each direction, roughly 3 to 5 repetitions in each direction. Remember to work at your end range of motion. Feel your muscles contracting. If it feels too easy, you're just not doing it correctly. We want to actually get to the end range of motion, provided that doesn't cause you any problems. If for some reason going to end range of motion causes you some discomfort, then you are welcome to use a smaller range of motion so that you can at least start the process and work through a range of motion that's more comfortable, and there is still value in that. So this is the first drill, and remember, you have your baseline assessment with your active leg raise. As soon as you finish this exercise, you immediately want to reassess to gauge, okay, how easy or difficult is this? How does it feel? Am I more comfortable, less comfortable? How far have I gone? And then mark your findings and move on to the next part of the protocol. All right, this second drill is called a femoral nerve glide. This is the part where I said we're going to go peripheral, meaning we're going to target a peripheral nerve that supplies the muscles of your hip flexors. Now, I'm just going to continue to work on the right side of my body as we go through the protocol. And what we're going to do here is set up a femoral nerve glide. And people are going to have to play with the position a little bit. I have this medicine ball here to elevate my rear foot. And what you would do is get into this half kneeling position that basically resembles kind of a traditional stretch for the hip. You don't have to elevate. You can be here. Some people may not have the mobility. And make sure you're kneeling on something soft if you have any difficulty with actually kneeling. So for me, I'm going to elevate. If elevating doesn't feel comfortable for you, you don't have to. So I place my foot on the prop that I'm using. This could be a medicine ball, it could be a stack of pillows, it could be the back of the couch in your living room. Use whatever you have, and you'll be fine. You don't need any special equipment. From here, what we're going to do is we're going to tilt our pelvis posteriorly. That means tuck our tail. I often will tell people, imagine you're pulling your belt buckle up towards your forehead. So if I do that, it's just a very subtle motion. Tuck my tail, pull my belt buckle up, and I'm going to maintain that position. Now, while maintaining that pelvic tilt, I'm now going to come forward into some hip extension. So that means that like my thigh has moved back like that. And so from here, I want to maintain these two pieces of the sequence, the pelvic tilt and the hip extension. I'm going to lengthen up nice and tall, and I'm going to begin slumping my back, meaning I'm going to round forward. Now, when I get to about here, I'm focusing on not losing the tensioning sequence of the lower body, and as soon as I get to here, I feel what is a neural tension kind of stretch sensation that's radiating through the front of my hip. It feels different than, say, a traditional stretch where you might feel tension on the muscle. This is kind of radiating, and it moves, and it's across a very broad area. That area is the front of the thigh, maybe inward just a little bit, closer to the inside of your thigh. So as I'm in this position now, what I would do is I would maintain an intensity in terms of the stretch feeling of a 3 out of 10. You need to hear this a couple times. A 3 out of 10 is the level of intensity that we're aiming for with this position. Why? Because we're tensioning a nerve. And nerves don't like to be aggressively tensioned, so we want to do it very gently. Once we have a 3 out of 10, and I'm there right now, the idea is to mobilize the nerve by moving from the hip. And you have two options. You can simply move forwards and backwards, very subtly, which is really me contracting my glute muscle to go a little bit further into the hip extension without losing the pelvic position, without losing the spinal position. So that would be one driver option. The next driver option would be creating small circles, which is a little bit more complex. It will take a bit more motor control, and you can just decide which one's better for you. Each variation here might give you slightly different results. And just make sure that if you do choose the circle, that you're performing the circle well with good coordination. You want it to be smooth, and as you move through the circle, if you feel that neural tension climbing, getting more intense, you just want to make sure again that you are around a 3 out of 10. Okay, so one more time here. I'm in this position, elevated or not. Tuck my tail. Come forward to get some hip extension. Lengthen up. Slump. There's my 3 out of 10. Now, either forwards and backwards, moving from the hip, or small circles. You can do each direction as well. Make sure you're relaxed. You're able to breathe as you do this. I don't want to move too fast either. And after about, say, 8 to 10 pulses, that little subtle motion coming from the hip, I'm calling that a pulse, like a repetition. After about 8 to 10 of those, you're done. That's all you need, and you are ready to reassess and mark your findings. All right, our next step here is going to be utilizing what we call opposing joint theory. Now, let's kind of work out a couple of things first. I'm working through this protocol with the right hip. Okay, so I'm doing every drill with my right hip, and I'm reassessing. So what we're saying is that there's a problem with hip flexion. Okay, when we lift our leg, maybe it feels limited with mobility, maybe you feel weak, maybe there's even pain. Okay, so understand that we're trying to improve this idea of flexing at the hip. Utilizing opposing joint theory, I'm about to teach you a drill for your opposite shoulder. So in my case, if I have a complaint about my right hip, I'm about to do this mobility drill with my left shoulder. So if you happen to have a complaint with your left hip, you're going to do the mobility drill with your right shoulder, okay? The shoulder, the opposite shoulder, is the opposing joint to the opposite hip. So right hip, opposing joint, left shoulder. So that's what you're going to see me do, and if you need to flip that for your own needs, then please do that. So we're going to take it one step further now. Looking at this through the lens of opposing joint theory, we're now going to create what I call a one-level mirror drill. So because hip flexion is problematic for me, I'm going to do a shoulder circle, which is a joint mobilization, and I'm going to put my shoulder into extension when I do it. Because we're using this idea of creating a mirror drill, we want to mirror or do the exact opposite of the problematic movement. So if hip flexion is my problem, shoulder extension may be the solution. Now, I put my left shoulder into extension, and now the goal is to perform a circle. And I'm moving from my shoulder. Okay, thinking about the humerus, right? This bone inserting into what is the shoulder joint, okay? I'm not thinking about my scapula, the triangular bone, right, on the back of my rib cage. I'm thinking about moving from the humerus, okay? That's really important. Now, like I was telling you with the hip circles, if this feels easy, you're not doing it correctly because you're not working at your end range of motion. So I want you to think about the top right there of that circle. I want you to think about that, and I want you to try to create the highest circle that you can, meaning that you're working really hard at end range of motion. And if you were to look at me from behind here, you can see that I'm creating this circular motion, really climbing for the top of that circle. And of course, I can go both directions. And like I said, if it's easy, you're not at that end range of motion and you're not working hard enough. In fact, for this to be most effective, I want it to feel like strength training. Of course, I don't want you moving into pain, so if you already have a previous shoulder problem, then please don't move into pain. But if your shoulder is healthy, we can utilize this very well, this idea, and just make sure that you're creating a smooth circle, you're concentrating on the shape that you're trying to create, you're moving from the target joint appropriately, and like I said, you're at end range of motion. You're contracting your muscles to really feel like you're strength training this range of motion. After you perform, let's say 3 to 5 really good quality repetitions in each direction with the opposing shoulder, you are ready to reassess and mark your findings. All right, we're at the last exercise. Remember, we're going to a higher order system. In this case, it's the visual system. And yes, your eyes have a ton to do with your movement and your function and your pain levels. So here's a little experience that I want to give you into that. Now, there's a couple of details that go into how we're going to lay this part of the protocol out for you. Remember, I'm working on a problematic right hip. And what that means is that I'm going to do the vision exercise that I'm about to teach you with my left eye only. So I'm actually taking my hand and I'm going to be covering my right eye and doing the movement that I'm going to teach you with my left eye only. So if you have a right problematic hip, you're going to do this exercise with the left eye. If you have a left problematic hip, you're going to do this exercise with the right eye. Now there are lots of different neurologic reasons why working with one eye or both eyes could potentially help you. I have structured this for you to try the single eye version first, but also realize that when you do this exercise that we're about to try, you could also do it with both eyes at the same time if you're not finding any results with the single eye version. And so just remember that as you work through it, you can try this one eye or both eyes and see what works best for you. So here we go. I'm going to cover my right eye, and I'm going to take this trusty little vision target here, my index finger and I'm going to place it out in front of me at an arm's length. I'm going to take my left eye and I'm just going to look at it. So I'm looking at my fingernail, and all I'm going to do is follow it in towards the tip of my nose, and then I'm going to follow it over to my right. And so what I'm asking my left eye to do is converge and go over to the right, and now I'm going to follow it back out. So think about the shape that you're creating as a triangle, and you're just tracing that triangle, following it in where it's a long line here, following it across. You need to make sure that you don't go too far. You won't be able to see that target anymore. And then I slowly follow it back to the starting position. Follow in, come across, follow back out. Now, understand that when I do this, notice that I'm following it in, and when I go across, my head does not move. Only my left eye has moved as it tracks my target over to the right. That's really important. You don't want to come in and then start tracking it and go like this. Lots of people will do that. So you need to pay attention to make sure you're being still. It's only your eye, okay, as you create that triangle. Make sure you're relaxed as you do that. Come out of it, do some blinking. Make sure that you give yourself permission to blink, just normally while you're doing the exercise. You can do anywhere from 3 to maybe 6 repetitions. Be sure that as you're practicing that, you don't feel any unwanted strain with your eyes. Some people don't have great convergence skills, and the eye muscle that we're training will have to work really, really hard to do the job that you're asking it to do. And if that gets too stressful, you might actually feel some eye tension kind of right in this area. If you're feeling that, that's your cue to stop. You've done enough repetitions, and that also tells you that that eye muscle is pretty weak and it's going to need some training in the long term, but you have to find the appropriate dosage so that you don't work into a place that gives you negative outcomes. You want to work up to that spot, feel good with what you're doing, and then stop. So again, 3 to 6 repetitions, smooth movements, go through that. And again, remember what we said here when we laid it out. If you're problematic on the right side, you're doing your left eye. And then after you perform that drill, you immediately reassess and mark your findings. And I think you're going to be really, really surprised with what could happen with this particular input. As I said at the beginning, if you do the single eye version and you don't really get the results you're looking for, then you can actually try 2 eyes at the same time, where now you're just following the target in and following it back out. I always tell people, as you come in, it's normal for things to get a little fuzzy in the last inch and a half as you get closer to the tip of your nose or the bridge of your nose, and that's okay. What you don't want to happen with the 2-eye version is you don't want your target to split into 2. If it splits into 2, it means you're going too far, so kind of use that to gauge your range of motion. If you follow it in, you're like, oh, right about here, it wants to split into 2, then that's where you're going to stop, and then you're going to follow it back out. And then you might find on the next repetition, oh, I'm able to go a little further, but oh, it wants to split again, now I'm going to follow it back out. And you just kind of work through the range of motion that your eyes are allowing without any problems. And then over time, you'll find that as those eye muscles get stronger at their job, you'll be able to go closer and closer to hopefully touching the tip of your nose, which is really what we call like the athletic standard in terms of how this works. So do the drill and then immediately reassess and mark your findings. All right, let's summarize a little bit. Let's talk about the 4-step protocol that we went through, and let me give you a little bit more insight into what we actually did there. So number 1, we got a baseline assessment, right? And that's really important. Then as you work through the protocol, you assess, reassess as you go to figure out which exercises in the protocol are highest payoff for you, or which ones might even regress you, and therefore you can just kind of leave them behind for now and focus on the ones that are helping you. If all 4 were great for you, awesome. I hope that was the case. Now, the first part of this protocol was I said we're going to go local. And what I meant by that is we're actually going to work on your proprioception. So we did a joint mobilization for the local joint that is problematic. The idea behind that is about proprioceptive mapping. We're actually trying to clarify your brain's map of that particular body part by moving your joint through its fullest range of motion. And that can be really, really effective working locally like that to help with function and pain. So that was the first part. We then moved on to what I called going peripheral. And what I meant by that is we're going to do a neuromechanic drill. So we're going to gently tension, in this case, the femoral nerve, and then we're going to mobilize it from the hip. The reason why that can be a potential, something that potentially helps you is because peripheral nerves are kind of the highway, if you will, that the muscles get their information from. So the femoral nerve happens to supply the hip flexors, and that's why we wanted to mobilize it. And that can be a really powerful exercise for people that are experiencing both weakness and stability issues in the hip and even pain. After that, we went to opposing joints. This is where things started to get a little bit weirder because we're working away from the problem, which is often something that has to happen, and this is the part that people ignore or they just don't know yet. But we used what's called a opposing joint theory. And opposing joint theory, the way that we covered it, was super simple, right? It actually goes much deeper than what we did in this video, but it's a good introduction. And we created a one-level mirror drill working on the opposite side of the body. In this case, we were working with the shoulder. The reason why this can be really effective for people, and let me say, like, when it is effective, it will work so good, it feels like cheating. I have done tons of what I call drive-bys in my career where somebody approaches me and they have a pain issue, and I put together an opposing joint mirror drill for them, and just like that, the pain is gone and we're slapping high fives, and we can't really explain what happened, but it's awesome. That happens all the time when people respond well to opposing joint drills. So hopefully that's the case with you. And really the neurology behind opposing joints is kind of, it's involving the spinal cord and the brainstem and some higher level reflexes that are kind of rooted in the human gait cycle, which is really interesting. Finally, we went higher order. And what I mean by higher order is we worked with a system that is the highest order system that we have, which is the visual system. Most of the sensory input that we take in from the external world that helps us understand where we are and how to move, right? That's coming in from our eyes. So when we do vision drills, we actually can change the way that we move very profoundly. And what we find is that with vision drills, you get some pretty amazing changes in joint function and muscle tone. And that's what we're trying to achieve with this step of the protocol. So I chose the opposite eye for some specific neurologic reasons and a specific neurologic pathway that we are trying to activate that allows us to affect the opposite side of the body by working with the opposite eye, and that can be super effective at times. And then I said, if that doesn't work for you, we'll now just go back and choose two eyes, and there are neurologic reasons why that might help. All right, there it is. If you made it this far through the video, then congratulations. I'm sure as things got weird, we probably dropped some people off, but that's okay because that's just how it goes. We're going into some things, we're going into the weeds, and we are, doing things and talking about them in a much different way than what people are used to. We're going beyond just the standard go local type of approach where we stretch and foam roll and then that's it. And the reason we're doing that is because movement comes from your brain, pain lives in your brain, and if we understand how to target very specific neurologic systems that are underperforming, then we can get some very, very good results, and we can usually do it in a lot less time than we would with a more traditional approach. So if you like this type of content, where we are affecting, fixing movement problems and helping you with pain issues using a neurocentric approach, then let me know because I am glad to shoot you more content like this. If you like this video, please give it the old thumbs up. And if you have any questions or you just want to share some exciting results that you're getting as you work through the protocol, then please let me know in the comments. I would love to talk to you, and I would love to help you out as you work through the material in this video. Last, please subscribe to the channel because it really helps. And that's it for today. Have a great rest of your day, and I will see you soon.